Hey guys, as promised, today I'm going to talk about a subject I get asked about a lot, and that is how to know if you have insulin resistance. This is a question I get asked all the time, and a lot of women have had their blood checked by their doctors, and maybe they're told they don't have insulin resistance. There's just a lot of confusion because first of all, we know insulin resistance is a big part of PCOS. So how many women actually have insulin resistance with PCOS? And I think we don't really know exactly. I've done a lot of literature research on this, and it seems like the statistics range tremendously. Some studies show 50%, other studies show 70%. A lot of experts like Dr. Fiona McCullough estimates about 75%. Thanks all you guys for joining. We're talking about how to know if you have insulin resistance. And then Dr. Gersh feels like almost every woman has insulin resistance. So we know that insulin resistance is a really big part of PCOS. It's kind of, they believe, at the heart of it. And I'm not going to really get into in detail what insulin resistance is. Check out the other video I did on my Instagram TV. Actually, it's in my feed where I'm wearing a leopard dress. So I talk all about what is insulin resistance. But today I want to talk about how do you know if you have it. So anyway, so studies show anywhere from 50 to 100% of women with PCOS have insulin resistance. But here's the thing. It's really hard to pick it up on a blood test, and that's, I think, where a lot of the confusion comes in. And there's also a lot of different ranges of degrees of insulin resistance. There's very, very mild insulin resistance, which would not be picked up on a blood test, and then there's a lot more, I guess, serious or stronger insulin resistance that definitely is picked up. So. Okay, how do we know if we have it? So I guess that's the first question. First of all, it's not just women with PCOS who have insulin resistance. Insulin resistance is really, really common. Here are some statistics. About 50% of adults, men and women, have prediabetes or diabetes. Yes, I'm going to try to save this. If somebody just asked me, I think my technology skills are getting better. The first two I didn't know how to save it, but I'm learning. So yes, I think I will know how to save this. So if you miss it, I'm going to put it up on my feed next week. This will be live in my stories for 24 hours, and then I'm going to put it up in my feed next week. So I'm learning how to save things. I'm getting better. And I'm also going to practice not saying and so much. I looked at some of my older videos, and like every 2 words I'm saying and it's like I'm like horrified. So I'm practicing not doing that. So anyway, so what I was saying is that insulin resistance is really common whether or not you have PCOS. The statistics show about 50% of adults have prediabetes or diabetes, men and women. And almost everyone who has prediabetes or type 2 diabetes has insulin resistance. Another statistic is about 66% of adults are overweight or obese. And almost every one of those people also have some degree of insulin resistance. So insulin resistance is really common. It just seems to be, I guess, cause more symptoms if you have PCOS, because they believe, again, that's part of what is at the heart of PCOS, and it can cause elevated levels of androgens and all that stuff. So anyway, so we know insulin resistance is common. For those of you who missed the beginning, I had said that it's believed anywhere from 50% up to 100% of all women with PCOS have insulin resistance. It will vary a lot. There's very, very mild insulin resistance, and there is more severe insulin resistance. So why is insulin resistance a problem, aside from the fact that it causes the symptoms of PCOS? It's a problem because if you have more of the severe insulin resistance, it can lead to more of the metabolic consequences. And this is even more important as you get older. How can I overcome insulin resistance? I'm going to do a whole live on that, I think, next week. Today I'm just talking about how to know if you have it, but next week I think I'll do a live on how to overcome it, because you absolutely can. Wait, what was I saying? I kind of lost my train of thought. Oh yeah, so why is insulin resistance bad, aside from the fact it worsens symptoms of PCOS? it can cause metabolic issues in your body. So when you're insulin resistant, you have an increased chance of getting pre-diabetes, then diabetes, and an increased risk of heart disease. So it's important to, deal with it from a lifestyle standpoint, which you can. So anyway, so we've established that insulin resistance is common in the average adult, whether you have PCOS or not, because a lot of people are overweight and have diabetes or pre-diabetes, but it's especially common with PCOS. So let's just say you go to your doctor, right? And your doctor probably does, they probably do a fasting blood glucose, and they might also have done your hemoglobin A1C, which you should know both of those tests, right? And maybe the doctor said, oh, your blood sugar is normal, your hemoglobin A1C is normal, you don't have insulin resistance. Well, that's not quite true. Now, yeah, if those are normal, it might mean you have less of a chance of having insulin resistance. Like if you go to the doctor and your hemoglobin A1C is 6.0, okay, that means you have pre-diabetes. Yes, you probably are insulin resistant. Do we know for sure? No, but you probably are. If your fasting glucose is above 99, chances are greater, yes, that you are insulin resistant, but it doesn't prove that you are. So anyway, so those are good tests. You always want to keep track of your fasting blood sugar and your hemoglobin A1C, because that can show if you're getting pre-diabetes. But it doesn't prove that you do or don't have insulin resistant. It's suggestive that you do if the numbers are high, but if your numbers are low, this is what I hear a lot. If you have a low hemoglobin A1C and a low fasting blood sugar, it does not mean you don't have insulin resistance. So that's number one. So the next test your doctor could do would be a fasting insulin level. And this is helpful for sure. I think the range goes from like 8 to 30 or something. So I might be wrong, but it's close to that. So let's just say your insulin is like a 28, okay, if that's what the range is on your blood work from your lab. So technically, does that mean you're not insulin resistant? Not necessarily. A lot of experts believe if your insulin is 10 or above, it still could mean you're insulin resistant. So I would definitely ask your doctor to do a fasting insulin test, because if it's high, yeah, you probably are insulin resistant, okay? And I would even say if it's anywhere over 14, it might mean you're insulin resistant. So that's easy. But what if you get that test done and it's fine? Let's just say I think a couple people had DM'd me and said their fasting insulin was like 8 or something. So, okay, so it shows your fasting insulin's not high, but again, it doesn't mean you're not insulin resistant. So what's the next best test that you can do? And I was actually talking to Dr. Fiona McCullough, who I love. I have like a girl crush on her. I was hanging out with her at the PCOS symposium, and we were talking. This is what we talk about at dinner, right? This is what like dietitians and doctors talk about at dinner, is like hormones and insulin resistance. And I was just curious to her. I said, in the United States, we don't really do this test. It's called an oral glucose tolerance test with insulin levels at the same time. So what that means is you drink this really sugary drink, I think it's like 75 grams of glucose, and then you sit there for like 2 hours, and they draw your blood like every half an hour or something. And when they draw your blood, they're checking for your glucose and they're checking for insulin. So they're looking for glucose and insulin. And Dr. McCullough said that she does it somewhat often in her clinic in Canada. She's in Toronto, so if anybody's listening who lives in Toronto, you want a fantastic doctor, check out Dr. Fiona. On Instagram, she's Dr. Fiona ND. She's a naturopath. So she was saying that she does that test, and she does it especially on her lean patients with PCOS. Because here's the thing, if you're lean, chances are your insulin resistance is not going to show up in a fasting insulin level. It's probably going to be normal. But what that test doesn't show is how does your body respond to carbohydrate after you've eaten a fair amount of carbohydrates. What happens then? And this oral glucose tolerance test with insulin levels will pick that up, because you're giving yourself this load of carbohydrate, and then we're checking to see, does your body kind of over respond and produce a ton of insulin after that meal. So pretty much that kind of test is checking what happens after meals, where the other test is just checking fasting. So kind of to summarize what I've said so far, I would recommend that everybody gets their blood glucose checked, their hemoglobin A1C checked. This does not show insulin resistance, but it may, but if it's normal, it doesn't mean you don't have it. The third test I would ask your doctor for is a fasting insulin test. If it's high, it definitely means you have insulin resistance, but if it's not high, you still could have it. And then the next test, which your doctor may or may not do, and that's the oral glucose tolerance test with insulin done at the same time. And in the United States, a lot of doctors don't do it. And I've asked for it a couple of times, and they kind of look at me like I have three heads, like, why would you want to do that? But so that's the next test. Another thing that you can do is I did a blog post that I hope you all will read. I just put it up today, and it's ways to diagnose insulin resistance in PCOS. And if you go to my blog on my website, marthamckittricknutrition.com, and do the search on insulin resistance, so there's a calculation that you can do. It's called HOMA, H-O-M-A. I don't know what it stands for, but so anyway, so you can plug in. Let's just say you've had your fasting glucose done and your fasting insulin done. You can plug those numbers into this calculation. It's like a calculator online, and it will tell you what your ratio is, and it will tell you if chances are likely that you're insulin resistant. And all those numbers are actually in my blog. I don't have them up right now, but if it's a certain number, you're likely insulin resistant. So I would definitely ask your doctor for a fasting glucose, a fasting insulin. You can plug it into that calculator. Again, none of these are guarantees that you are insulin resistant, but they're indicators that you might be. Another thing that you could do to possibly see if you're insulin resistant, there's another formula. Again, you need your fasting insulin and your fasting glucose. It's in my blog. So basically, you take your fasting glucose, let's just say it's 90, for example, and then you take your fasting insulin, let's say it's 15. So you divide 15 into 90, and the answer is 6. So with this test, if your ratio is less than 4.5, it's likely that you're insulin resistant. So again, you take your glucose divided by your fasting insulin, and if the answer is less than 4.5, it's likely you're insulin resistant. So those are the major tests, the major blood tests that we use. And then there's something called the euglycemic, the hyperinsulinemic euglycemic clamp. And you never want to have that test done, because those tests are only done in experiments, and you have to sit in a lab for 3 hours, and you have like a glucose IV in this arm and an insulin IV in this arm, and it's supposedly a very unpleasant test. They only do it in labs, but that is the gold standard to see if you have insulin resistance. And if you ask your doctor for that test, they're going to think you're crazy, so forget about that. So, okay, so those are the actual blood tests. And if you missed anything I said, I am going to try and save this onto my Instagram TV. I'm getting better with technology, so I'll figure it out. So let's move on to other ways you can figure it out. And these ways are actually really important. And these a phone call. So these are signs and symptoms. So what are signs and symptoms? If you look at the post I put up today on my in Instagram, I listed some of them, and some of them are. Let me just pull it up. Is if you have skin tags, like, on your neck or on your arm, like those little skin tags. Yes, PCOS and thyroid are definitely related. They can be, and I will do another live on that at another time, but they definitely can be a relationship. So what are the signs and symptoms? So let's just say your blood work was all normal and it doesn't seem like you're insulin resistant by blood test, but look at signs and symptoms. One of them is skin tags, especially like on your neck or your arms. That could be a sign of insulin resistance. Now, I may have one skin tag on me somewhere. It doesn't mean I'm necessarily insulin resistant, but you have a lot of them. It could mean that you are. Another sign is if you have dark patches of skin. A lot of times it's called acanthosis nigricans, and it's a dark velvety patch of skin. It's oftentimes on your neck, or it could be in your groin area. And that can be another sign of insulin resistance. I don't know why, I don't know why that would happen, but it does. And if you have, a good doctor who examines you, and I actually had somebody DM'd me, and they said all their blood work was normal for insulin resistance, but the doctor immediately looked at them and they saw the dark patches of skin and the skin tags, and the doctor immediately said, you're insulin resistant. So that's interesting to know. So those are two signs. If you have a larger waist, like if you have more like an apple shape, especially if you're overweight, but not necessarily, it can also be if you're lean too. But if you have more like weight in the tummy area versus like legs and thighs and butt, that's another sign of insulin resistance. So another thing you can do is take a waist to hip circumference ratio. So basically you want to take a tape measure. I would do an experiment on myself, but I don't really want to do that right now. So I've actually never done this, but anyway, you take the tape measure around your waist, I guess the smallest part, and then you would take it around your hips, I guess the biggest part, and you divide that. So the example would be, let's just say if your waist is 32 inches and your hips are 35 inches. So you take 32 divided by 35, and the answer is 0.91. Anytime you get an answer that's 0.8 or greater, it's suggestive of insulin resistance. So this is actually a good test that even like lean women with PCOS can use, because some women are very lean and they have very little fat on them, but they do have a little bit of a belly and a little more of an apple shape. So that's a good way to see if you may be insulin resistant. Now again, I'm not guaranteeing that you are, but these are suggestions. So we have the skin tags, the dark patches of skin, the increased waist to hip circumference. This is another one that I don't really think is that accurate, because some people are bigger and some people are smaller. But another one they say is if your waist is 35 inches or greater for a woman. But I don't know how accurate that would be, because what if you're like 5'11" versus somebody who's 5'1"? I mean, isn't the person who's 5'11" going to have a bigger waist? I mean, so I don't know about that one, but I do like the waist to hip circumference ratio. Another one could be if you have a really hard time losing weight, or if you gain weight like really easy. How should we eat it for insulin resistant? Do we need to find our carb tolerance? I will address that when I do my live on diet and lifestyle tips for insulin resistance. That's a really good question, but I will address that next time. So if you have a really hard time losing weight, or you gain weight really easy, especially if it goes in your belly area, there is a greater chance that you're insulin resistant. So I guess, what's the bottom line here, right? I mean, the bottom line is that the majority of women with PCOS have some degree of insulin resistance. Now, I'm sure you've all heard, that there's like 4 types of PCOS and all that. I'm not going to get into that right now, but some people have you take this quiz, and if you check off these things, it means you're the insulin resistant type of PCOS, and if you check off these things, it means you're the inflammatory type, and if you check off this, you're post-pill. There's like 4 types, okay? And that may or may not be true, and my kind of feeling is on that is a lot of women kind of might have a couple different types, so I don't think it can be so clear cut that this is your exact type, and if you have this type, this is exactly what you do, and this type, this is exactly what you do. I don't necessarily agree with that, but I think in general, yeah, there are several types, and I think in general, there are women who are more insulin resistant. What that would be, in my opinion, would be somebody who is quite overweight or obese, somebody who has a really, really hard time losing weight, somebody who perhaps on the blood test high insulin levels did show up, or you definitely have a very abnormal waist to hip ratio. So chances are, yes, you are very insulin resistant. and you do have an increased risk of the metabolic complications I spoke about earlier, and that's the increased risk of diabetes, pre-diabetes, and heart disease. So yes, so definitely you want to be super careful with your lifestyle. Then you might have somebody else who has more milder insulin resistance, and you still want to be careful with your diet and your exercise. It's not, I guess, quite as crucial, but regardless of your level of insulin resistance, and even for me, I do not have PCOS, I'm not insulin resistant, I'm very passionate about PCOS, but I don't have it. I even follow kind of a lifestyle and a way of eating for insulin resistance. I think everybody should. So it's not like if you're highly insulin resistant, you have to be on this crazy no-carb keto diet. You don't have to do that. And I'm going to talk about next week the diet and lifestyle for insulin resistance. But basically, you want to be on a healthy diet. You don't want to have a lot of sugar. You don't want to have a lot of white carbs. You want to eat balanced meals. You want to get enough sleep and stress management and exercise. And if you are overweight, and if you can lose even a little bit of weight, you are going to greatly decrease your insulin resistance. So that's kind of the take-home point here, is that if you are insulin resistant, it doesn't mean that you're doomed. You can change it. And I'm not saying it's easy. And you don't necessarily even have to lose a lot of weight, or even any weight, kind of. But if you have a healthy kind of diet and exercise and maybe some supplements, abnormal waist to height, yes, I talked about that. So if you missed that, check out my blog post. I talked about abnormal waist to height measurement. That definitely is an indicator of insulin resistance. But anyway, so I was saying, I think pretty much every woman with PCOS should follow the healthy diet and lifestyle for insulin resistance, because it's a healthy diet. And the diet for insulin resistance is kind of the same thing as the diet, an anti-inflammatory diet. They're pretty much kind of the same thing. Maybe a difference could be if you're very insulin resistant, some women do better cutting carbs a little bit more than other women, but that's super individual. So that's something where you would have to figure out what works for you. I also do individual coaching, so if you want me to work with you, I can really help you with that. So definitely DM me. I don't promote myself a lot, which I'm going to start doing because PCOS is my specialty, and I do a lot of coaching on PCOS virtually and in New York City, where I can kind of map everything out for you and give you like a whole plan. But so I guess if you, let's just say the blood test shows you're not insulin resistant, but you have a lot of the signs and symptoms that I mentioned, you probably are insulin resistant. And even if you're very lean and all your blood tests look normal and you don't have the signs and symptoms of the skin tags and the dark patches, but you have a little extra belly fat, or your hips and the hip to waist ratio is a little bit off, you probably have some insulin resistance. Are you as insulin resistant as the first person I mentioned? No, but you probably have some insulin resistance. Here's an example. Let's just say that it doesn't seem like you're insulin resistant. So all your blood test is normal, you don't have any signs and symptoms, but you're not ovulating. And your doctor says, I don't think you're insulin resistant, but just take metformin, let's just see what happens. So let's just say you don't change anything and you take metformin and all of a sudden you've started to ovulate. That kind of shows you were insulin resistant and that your ovaries was getting too much insulin, and that's why you were producing the androgens, so you didn't ovulate, and now that you took metformin, you started to ovulate, so you were insulin resistant. So that's kind of an indicator that you were. Somebody just asked about Ivositol. I will talk about Ivositol in one of my talks. I did a whole blog post on that if you check out my blog. I am a fan of Ivositol, and I think next week when I do my live on lifestyle and diet, I will talk more about supplements, but Ivositol or inositol, my favorite brand is Ivositol, but it doesn't have to be Ivositol. Inositol works in a kind of similar way, but not exactly, like metformin. So it can help decrease insulin resistance, and some women get great results on it. I mean, not everybody does, but it is one of the top supplements I recommend that might help with insulin resistance. So does anybody else have any questions about diagnosing? So just to kind of summarize, I know what I kind of forgot to talk about really fast, is that if you look at the graphic I put up today on insulin, My second graphic talked about something called the metabolic syndrome, and this affects men and women, but today we're talking about PCOS. In that, look at that graphic, okay? And if you meet 3 out of 5 of those, you likely have something called the metabolic syndrome, and it means your insulin resistance, pretty much for sure. And it also increases risk of heart disease and diabetes. So that means if you have an elevated blood pressure, or if you're on medication for blood pressure, if you have the central obesity, if your waist is over 35 inches, if your fasting blood sugar is over 100, or if you're taking metformin or medication for blood sugar, if your triglycerides are over 150, or if your HDL is below 50. If you have 3 out of 5 of those, the graphic is actually on my feed today. It was the post I did on how to diagnose insulin resistance. There were 2 graphics, so you got to slide over, look at the second graphic. The first one was the blood test and the signs and symptoms, and the second graphic was called metabolic syndrome. So it should be up there. Yes, lean PCOS can be insulin resistant. Definitely, absolutely can be. And I'm going to save this talk on my live if I can figure out how to do it. So you will get this whole talk next week on my Instagram TV, and you can also get this talk, it'll be on my live for the next 24 hours. The doctor said my insulin is a 6, which is low and healthy, but my weight keeps going up. She said I might be insulin resistant. Yeah, you absolutely might be. And if you catch the beginning of my talk today, I did talk about that. Just because your insulin is a 6 or a 7 or an 8, it does not mean you're not insulin resistant. The range goes up to about 30, but a lot of doctors feel if you are even close to 10, you could still be insulin resistant. Or if your insulin's low, but you keep gaining weight, you still can be insulin resistant. So those labs aren't 100% accurate. That's kind of my whole point. And that's why a lot of doctors maybe don't want to pursue, blood testing, because they're not that accurate. And the fasting insulin is not that accurate because your blood sugar varies all day long. Your insulin varies all day long. And when you get a fasting insulin, it's what it is at that minute. It's not testing what it is all day long. So you can use that as a guide, but if it's normal, don't think you're not insulin resistant. I have some fat on my belly and a lot in my thighs. Your waist-to-hip ratio is 6.6. If you have a hard time losing weight, you could be. Your waist-to-hip ratio is actually okay. So, you don't fit that criteria, but if you have a really hard time losing weight, you still could be insulin resistant. Keep in mind, 66% of the population is overweight or obese, men and women, and the majority of people who are overweight, especially if they hold some fat in the belly area, it means that they have some insulin resistance. Would leptin be the best predictor of insulin resistance? I don't think we know enough about that. It indicates that you are, but I don't think right now we can say if your leptin levels are out of the range that you're definitely insulin resistant. These are all little clues that you are, but I don't think we can just look at that and say, yes, you are 100%. But if you struggled with your weight, if you gained extra weight in the abdominal area, chances are that, and you're having a hard time losing weight, chances are that you could be insulin resistant. So that's it. If you have any other questions, definitely put them in my post today on my feed and I'll try to answer them, or shoot me a DM and let me know if there are any subjects you want me to talk about. Somebody else that just asked, does hair loss have anything to do with insulin resistance? Well, in a roundabout way, yes, because when you have PCOS, you tend to have insulin resistance, which causes the elevated androgens, which causes the hair loss. So yes, insulin resistance can have something to do with hair loss in a roundabout way. If you have PCOS. So somebody asked me what's better, metformin or inositol. Some studies have shown that inositol is even better. But they work in similar but slightly different ways, so I guess you have to find which one works better for you. I kind of like starting naturally with like inositol or Vositol, and then if that doesn't really get you the results that you want, you could try metformin. I'm not against metformin. I don't think every single woman with PCOS needs to be on metformin, but I almost would say it's split down the middle. I think some women say it's really helped them a lot, and other women say they had a bad experience, they couldn't tolerate it from a gastrointestinal standpoint, or it didn't do anything for them. But I'm not against metformin, but I like natural first. I like diet, lifestyle, exercise, stress management, supplements, and then you could look more for medications. Are androgens always raised with insulin resistance? Not necessarily. Some women with PCOS do not have elevated androgens, but they would have irregular periods, no ovulation, they could have cysts on their ovaries, so you don't always have to have elevated androgens with insulin resistance. What about birth control pill and inositol? I don't think I'm going to talk about birth control today. It's a little off topic. Inositol I am a fan of, and I'm going to talk more about it next week. So anyway, so to end this, because I do have a client coming in 5 minutes, I hope you found this helpful, or I hope it didn't confuse you more, because it's confusing. And don't feel like, if your blood work comes up normal, you don't have insulin resistance, because you still probably do. It might not be severe enough to show up on a blood test, but you probably do have it. Can I use inositol during ovulation days if I'm trying to get pregnant? Yes, you can. You can definitely use inositol while you're trying to get pregnant at 100%. So check out my blog on my website, Martha McKittrick Nutrition, if you haven't already done so. If you sign up to get my blog, you'll get lots of freebies. I have like free meal plans. I have a free little nutrition book. I'm actually working on a meal planning guide, a nutrition and meal planning guide. I'm already up to page like 70, so that's going to be coming out in about a month. I will charge a small fee for that, not a lot, but because I'm putting a lot of work into it. You're going to get tons of recipes and meal plans and nutrition tips, and all these questions you guys are asking are going to be in that book, so it's going to be really good. And I'm going to try and make it be so people in other countries can use it too. And if you're interested in individual coaching, that is what I do. And so DM me and I can shoot you some information. All right. And hopefully I can save this from a technology standpoint. So let me concentrate now while I'm shutting this off so I can save it and not lose it like I do a lot. Thanks a lot, guys. Have a great weekend.